Good day everyone, I am Tetracycline and I am here today to talk about my autobiography. My drug classification name is Tetracycline. The generic names under me are cotrimoxazole, demeclocycline, doxycycline, minocycline, and tetracycline. My drug classifications are as follows. As a therapeutic drug, I am an antibacterial, and as a pharmacological drug, I am a tetracycline. My pregnancy category is pregnancy category D. My teratogenicity in humans has been proven. We are associated with congenital defects and in large doses being linked to maternal liver toxicity.
Pharmacokinetics Absorption Bioavailability is less than 40% when administered via intramuscular injection, 100% intravenously, and 60 to 80% orally for fasting adults. Food or milk reduce GI absorption of oral preparations of tetracycline by 50% or more. Distribution It is widely distributed into the body, tissues, and fluids, including synovial, pleural, prosthetic, and seminal fluids, bronchial secretions, saliva, and aqueous humor. CSF penetration is poor. Drug crosses the placental barrier and is 20% to 67 protein bound. Metabolism First generation tetracyclines are not metabolized, though 5% of tetracycline is metabolized to a less active metabolite. Instead, they are most often eliminated by renal excretion. Second generation tetracyclines are 3 to 5 times more lipophilic, which enhances their tissue penetration. Excretion They are concentrated by the liver in the bile and excreted in the urine and feces at high concentrations in a biologically active form. Mechanism of action Tetracycline passively diffuses through porine channels in the bacterial membrane and reversibly binds to the 30S ribosomal subunit, preventing binding of the RNA to the mRNA ribosome complex and thus interfering with protein synthesis. Indications Tetracyclines are indicated for the following medical conditions: treatment of infections caused by susceptible strains, such as Rickettsia, M. pneumoniae, B. recurrentis, H. influenzae, H. ducreyi, bacteroides, V. coma, and Shigella, D. pneumoniae, and S. aureus, adjunct in treatment of protozoal infections. Contraindications The following are contraindications and cautions for the use of tetracyclines. Known allergies to tetracyclines or tartrazine. Pregnancy and lactation. Effect on developing bones and teeth. Fungal, mycobacterial, or viral ocular infections. Ophthalmic preparations can kill both undesired bacteria and normal flora. Use in caution in children below age of 8 can potentially damage developing bones and teeth. Hepatic or renal dysfunction. Drugs are concentrated in the bile and are excreted in the urine. Side and adverse effects. Use of tetracyclines may result in these adverse effects. For the GI, it causes nausea, vomiting, diarrhea, abdominal pain, glossitis, dysphagia, fatal hepatotoxicity. Skeletal bones, weakening the structure and causing staining and pitting of teeth and bones. Dermatological, photosensitivity and rash. Superinfection, pain and stinging with topical or ocular applications. Hematologic, hemolytic anemia, bone marrow depression. Hypersensitivity reactions, urticaria, and anaphylaxis. Intracranial hypertension.
Nursing responsibilities. Before I am given, the nurse should assess the history and the examinations. The nurse should assess for possible contraindications or cautions, perform a physical examination to establish baseline data for assessing the effectiveness of the drug and the occurrence of any adverse effects associated with the drug therapy. Examine the skin for any rash or lesions to provide a baseline for possible adverse effects. Perform culture and sensitivity tests at the site of infection to ensure that this is the appropriate drug for this patient. Note respiratory status to provide a baseline for the occurrence of hypersensitivity reactions. And lastly, evaluate renal and liver function test reports, including BUN and creatinine clearance, to assess the status of renal and liver function, which helps to determine any needed changes in dose. During the time that I am given, the nurse should check culture and sensitivity reports to ensure that this is the drug of choice for this patient. Arrange for repeated cultures if response is not as anticipated. Monitor renal and liver function test results before and periodically during therapy to arrange for a dose reduction as needed. Next is to ensure that the patient receives the full course of tetracycline as prescribed. The oral drug should be taken on an empty stomach 1 hour before or 2 hours after meals with a full 8-ounce glass of water. Concomitant use of antacids or salts should be avoided because they interfere with drug absorption. These precautions will increase drug effectiveness and decrease the development of resistant strains of bacteria. Discontinue the drug immediately if hypersensitivity reactions occur to avoid the possibility of severe reactions. Provide small, frequent meals as tolerated. Frequent mouth care and ice chips or sugarless candy to suck if stomatitis or sore mouth are problems to relieve discomfort and ensure nutrition. Monitor for signs of superinfections to arrange for treatment as appropriate. Encourage the patient to apply sunscreen or wear clothing to protect exposed skin from skin rashes and sunburn associated with photosensitivity reactions. Lastly, instruct the patient about the appropriate dosage regimen, how to take the oral drug, and possible side effects to enhance patient knowledge about drug therapy and to promote compliance. After I am given, the nurse should evaluate through monitoring the patient's response to the drug, monitor for adverse effects, evaluate the effectiveness of the teaching plan, and monitor the effectiveness of comfort and safety measures and compliance with the regimen. The nurse should also teach the patient or the family trying to drink a lot of fluids and maintain nutrition even though nausea, vomiting, and diarrhea may occur. Use a barrier contraceptive method because hormonal contraceptives may not be effective while a tetracycline is being used. Know that superinfections may occur. Appropriate treatment can be arranged through the healthcare provider. Use sunscreens and protective clothing if sensitivity to the sun occurs. Know when to report dangerous adverse effects such as difficulty breathing, rash, itching, watery diarrhea, cramps, or changes in color of urine or stool. Thank you for listening, and I hope you all have a good day.